Hi, my name's Gary, and I'm a retired Air Force physical therapist, and I just recently had a anterior cervical discectomy infusion, and I thought I would make a YouTube video and tell you about my experience. Unfortunately, over the years, I've had many orthopedic surgeries, so I'm not new to surgeries by any means. As you're doing now, probably you're searching YouTube looking for videos about ACDF. And I looked at several and I gleaned a little bit of advice from each of them. So I thought I'd add my 2 cents. I hope you enjoy it. What I found on some of the videos is they talked about how wonderful they felt, how easy it was. So I think I had an over optimistic view of how this would go. And so that's another reason I'm posting this video, is mine wasn't quite seemingly that easy. So Monday I go to the hospital as usual. They take me to the OR. They knock me out, and then I wake up in my room several hours later. I have twin 19-year-olds. They were there with me, but I was so sleepy from the anesthesia, I could barely talk. I kept falling asleep. I couldn't keep my eyes open. But immediately I found that my throat was very swollen and sore, and I had trouble swallowing. I had difficulty speaking. I still have trouble speaking. This isn't my normal voice. And I had trouble, like just then, trying to clear my throat. Now, I can't tell for sure if there's actually some liquid or other fluid in my throat that is causing me to kind of gag and want to clear my throat, or whether it's the sensation of that because my throat is still swollen and sore. But either way, you're going to find yourself clearing your throat over and over again, which probably irritates those people around you. When I initially woke up, I didn't have a whole lot of pain in my back of my neck, in the cervical area, or down my arm, because I still had much of the effects of the anesthesia. Prior to surgery, I had a lot of pain in my back of my neck, down my shoulder, and down to about my elbow. And then my thumb is almost totally numb, and my index finger is partially numb. That has improved only a little bit since the surgery, but as your surgeon will probably tell you, that sensory symptoms are the first to go and the last to come back. So it may be weeks, months before this tingling numbness comes back, if it ever does come back. But the pain is reduced, so that was good. Even now, 6 days later, if I'm semi-reclined, I always feel like I have fluid in my throat, and I kind of cough and choke. So the best position for me is sitting straight up or standing straight up. Also, when you go from standing to leaning back, it gets a point where you're about a 45-degree angle, where that puts a fair amount of stress on your neck, and that hurts a lot the first day or two. That has gotten much better, so now I can get in and out of bed from semi-reclined to upright and back without that really hurting me anymore. So I'm going to start off giving you some hints for when you're in the hospital, as most of the time you'll probably stay in one night overnight. Hint number one, stay ahead of the pain. Don't try to be brave and suck it up and delay getting your pain medication, because once the pain sets in, it's much harder to get the pain back under control. Plus, you're not going anywhere, you're not doing anything. Just go ahead and take the maximum amount of the pain meds and just keep yourself zoned down and comfortable. That's what I would say. If you can stand up and move around, that helps, because as you move around, even just walking to and from the bathroom, that increases your body's metabolism, which then helps get some of that anesthesia stuff out of your system. It just makes you feel better to get up and moving around. I don't know why, but it wasn't until late the first night at the hospital, I finally asked the nurse if I could have a throat lozenge. And she said, oh yeah, we have those. And so then they started bringing those into me, and that made my throat feel a lot better. I don't know why they didn't offer me that right away, or why I didn't think about it. Probably because I was drowsy from the meds, and I couldn't think straight. But once they started giving me the throat lozenges, that helped a lot. So another hint that I forgot to mention earlier was, your doctor will probably tell you this, but when you're on the pain medications and muscle relaxants, it often will cause constipation. So don't be surprised if you go 3 or 4 days without having a bowel movement. Also, another hint for hygiene is when you're brushing your teeth and you're wanting to spit out the toothpaste, it's not good to bend forward, and if you just try to spit it out, you're likely going to get it here. So what I do is I use a little IKEA bowl and cup. So I'll brush my teeth, and then I'll put this bowl up here, and I'll spit into the bowl, and then rinse and spit, and then pour that into the sink. And that way you're never bending forward, which is better for your neck. For sleeping at home, initially I had just a bunch of pillows on my bed. They would shift every time I'd get up. So I ordered a wedge, a memory foam wedge, actually 2 of them from Amazon. One was $30, the other was $40. One was 7 inches tall, the other one was 8.5 inches tall. I still have pillows on top of the wedge, but the wedge gives a nice even base so you can lay down comfortably in your bed. The other thing is, because this prevents you from looking down, you want to make sure your house is clear as possible from tripping hazards. We have a golden retriever, which we all love dearly, and she's a sweetheart, but she leaves tennis balls and bones and toys and socks and everything all over the floor, which can be a tripping hazard. And if you can't look down to see what you're walking over, it's real easy to trip. So do as best you can to clear your floor of any kind of tripping hazards, because you can't look down. Another hint at home is to have cold fluids to drink. Cold feels better for your throat. So I have push pops, sherbet, applesauce, yogurt, ice cream, popsicles, just cold drinks. For nutrition, I use muscle milk, and so not only am I drinking a cold liquid, but the muscle milk's got extra protein, so hopefully it'll help me heal quicker. The other thing that was very helpful, it was my wife's idea, and then my daughter, one of my 19-year-old daughters, performed it for me, was she made this medication chart for me. It's covered with plastic, so I have a dry erase pen, and so it's real handy to keep track of things. Now, those of you, particularly the guys in the audience, if you think that because you have a titanium plate and screws in there, things are really stable, so you really don't have to wear this or be careful, that plate is only on one side of the vertebra. So if you were to, for instance, take 2 2x4s and put some kind of mending bracket here and put a screw on here and a screw on there, even if you had 2 or 3 screws on each side, if you didn't have any screws on the other side, the 2x4 could still go like this. So what I'm saying is, even though the titanium plate and screws does give you some stability, and then I have cadaver bone in between the vertebra where the discs were, that still isn't a super stable position right now, because your own bone will slowly ingrow to the cadaver bone, and then it'll be much more solid. They say the good fusion occurs in about 3 months, but full, good, solid fusion can take somewhere of 9 months, even a year. So you got to be careful, even though you think, oh, I've got plates and screws in there and I'm real solid. So my doctor's requirement is I have to wear this 24/7. The only time I can take it off is when I'm eating or drinking something, because it does kind of inhibit your swallowing. And then also, when I get ready to take a shower, he gave me a rubber one, which I replace this one because this one's just a rubber one. And so when I'm in the shower, I shower with that rubber one on, and then once I dry off and everything, I put this back on again. I was allowed to shower on day 3. I have a walk-in shower, and we have a shower chair, and I don't use the shower chair to sit on, but I have that in there so I can put the shampoo and soap so it's at the level. One of the spine precautions is you're not supposed to bend way forward or when way back or rotate side to side. So I use the shower chair in there to hold things up closer so I can reach them. Okay, so again, I'm at day 6 and I'm feeling pretty decent overall. I'll tell you though, day 3 and 4 were very, very hard on me, and I really got into a low, dark place. It was frustrating because I had trouble eating, I had trouble drinking, I had trouble sleeping. I could never get in a comfortable position no matter what position I was in. And really, it seemed like this wasn't ever going to end. And so I reached out to some of my friends, just chatting with them or even texting them or emailing them was good for emotional support, and it really helped me. So it's good to have an emotional support system. And you know, as horrible as day 2 or 3 or 4 may be, I would like to think that, like me, that perhaps by day 5 or 6, you're doing considerably better. I think I'll end the video for right now, and then I'll add to it later as I'm doing a little bit better. But for those that are facing the surgery, there's a lot of data to say that this surgery is very helpful, but it's a long road, and it's a hard road, especially the first several days. So if you look at the videos where people are out like 2 weeks out and they're saying, "Oh, I feel great, this is wonderful," please know that there were some bad times in there too, as they were with me. So I hope you found this to be an informative video. I'll give you an update probably in another week. I hope you've enjoyed the video. Again, my name is Gary, and I hope you have enjoyed the video. Thanks.